For a lot of people, a full head of hair represents youth and attractiveness. Now, if you are bald or balding and you're looking for how to get back that full head of hair, there may be a procedure that's right for you. I am here at the Ferguson Clinic with Dr. John Ferguson, and today we're talking about a procedure called neograft.
Yes.
What is that?
Neograft is a revolutionary new hair restoration system that allows us to use the clinically proven technique of harvesting single hair grafts and transplanting them, but without that nasty scar that you get in the back.
Okay, so in layman's term, you're actually getting hair from...
We are taking single pieces of hair, single grafts from a donor site and transferring them one by one.
To where you don't have hair.
Where you want your hair.
Okay, that makes sense. Now, who's the candidate for this?
Well, basically anybody with any kind of hair loss. We've done men, we've done women, we've done eyebrows. If you've had a facelift and you've lost some hair somewhere, we can do scars, lip scars, those kinds of things work great. Guys with patchy beards, I mean, everybody wants the cool beard nowadays. We can actually do beards to make them a little bit fuller in areas that they're a little thinner.
So what exactly is the procedure like?
Sure. Well, what we do is have the patients come in here. We do pictures, we talk about it for a while. We shave a little strip in the back of the head where you would typically do the harvesting with the traditional strip method. We make that numb, and then we have a little device that actually it harvests each single hair follicle separately. And so instead of this big field that you got to cut out, you're basically just sampling a field, so you still have hair there. There's no scar to heal. Within about 2 days, you can't even see the harvest site because the hair is already grown. Now, we take them out of the machine, separate them into the different size grafts, and then we implant them where we want. Make a little harvest, and I draw it all out, how we want it designed. There's different size hair grafts, and we put them on different ones, and we create this new natural hairline or fill in a place that really just needs it.
So how long is the procedure?
Well, it depends. A small procedure is about 500 grafts or less, and that could take just a couple of hours, but we can always go up to 1,000, 1,500, 2,000, which can take all day. I mean, we're talking individual little grafts, like 10, a couple thousand of them. I think the longest we've done is about 10 hours, and that was a lot of grafts.
Okay.
A lot of grafts.
And what kind of results can someone expect?
It's amazing. At first, I'm perfectly honest, all the hair falls out that you transplant within about 2 weeks. And then over the next several months, up to 6 months to a year, it just is growing in nice and naturally. And our retention rate in the literature using this, what we call follicular unit extraction technique, is about 89%. All right. Some studies a little higher, a little lower, but when you're talking 1,000 grafts, 890 grafts is pretty damn good.
Okay, so neograft. All right, that's really interesting. But you are waiting. It'll take about 6 months.
It does take 6 months to get the But if you start noticing, because sometimes there's people who need more. I mean, you've got somebody with huge male pattern baldness. You're talking 3,000 grafts there. Nice thing is we see what's taking. In 6 months we can do another harvesting procedure and do that. So you could keep on going back, but when you start doing the strips, you can't. There's only a fine way that you can stretch it without putting expanders in there and that kind of stuff.
All right, Dr. Ferguson, thank you very much.
Thank you.
Again, the procedure is called neograft, and you can make a consultation.
Absolutely.
And get more information about it. Thank you.
Thank you.